right, so now I have the honor actually of introducing our keynote speaker, who has in fact been instrumental in shaping what we now know as planetary health. Dr. Steve Osofsky is the J. Hyman Professor of Wildlife Health and Health Policy in the College of Veterinary Medicine. And Steve, I think I butchered your last name, but I hope you Steve, there we go, all right. Prior to this, he served as a wildlife veterinarian in Africa, as a zoo veterinarian, biodiversity program administrator at the U.S. Agency for International Development, USAID, an executive director of the Wildlife Conservation Society's wildlife health programs around the world. As one of the intellectual catalysts and leaders for One Health and planetary health concepts, Steve's focus is on the relationships between wildlife health, domestic animal health, and human health and well-being, all in the context of climate sustainability. Indeed, at Cornell, he recently helped the university launch the Cornell K. Lisa Yang Center for Wildlife Health, which I hope we'll hear about in his talk. So without further ado, please join me in welcoming Steve to the podium, and we look forward to your presentation.
All right, just doing a little bit of AV setup here. And I guess you guys in the back are switching, or do you want, there we go. All right. All right. So I've got can you hear me with this mic? You guys hear me okay? So thank you so much for inviting me here today. I'm very excited. And what I'm going to do is blend a little bit of the personal professional. I'm sure many of you have trouble teasing apart your personal journeys and your professional journeys. And I'm going to start off by taking you back to the launch of the concept of planetary health. We're approaching the 10-year anniversary of the launch of what is a transdisciplinary field. And I'm going to take you to, I'm going to show you 10 minutes of a video from the Aspen Ideas Festival, because I think it really sets the stage for the work we're still doing today on this important set of issues. So let me do that, and then we're going to talk some more in detail.
Good afternoon. When I was talking to Donna Shalala earlier, she says we have 1 hour to cover the planet. So we better get started. My name is Michael Myers, and I'm a managing director at the Rockefeller Foundation. So it's a pleasure to be here. The issue we're facing today is something, an emerging new field or a new way of thinking called planetary health. And I got fixated on this, if I may say, when I realized that air pollution is killing more people on this planet today than HIV, AIDS, and malaria combined. The nutritional content of our foods is changing as the climate changes. And that has great implications for the health of people on the planet going forward. Our environment itself may soon be one of the top killers that humans face on this planet. So there's an urgency to this question of planetary health and what we should do about it. At the Rockefeller Foundation, we're proud that we had a part in building the field of public health in the last century. But we feel like that we've been called again to go at it again for a new kind of approach to public health, a public health 2.0, that takes into account the health of the planet and its implications on human health going forward. To get this thinking started, we joined together with The Lancet, the global health magazine, the global health journal, And there was a Rockefeller-Lancet Commission on planetary health. And if you want to read the report of that commission, it's quite good. It came out in July of last year, and you can go on the Lancet website, and it's all right there. But what they concluded was, yeah, there's something to this thinking. There's science there that still needs to be developed. There are new ways of thinking. There are new other disciplines that need to be brought into this conversation to deal with this pressing issue. Because, as I said earlier, more increasingly, our health as human beings on this planet are tied to the health of the natural systems on the planet itself. So this is a major question for us going forward, and at the Rockefeller Foundation, we're committed to doing our part to build this new field. We're honored and pleased to have today 5 amazing leaders in this field and other fields. So let me take a few moments to introduce our panelists this afternoon. To my right is Steve Osofsky, who's with the Wildlife Conservation Society, but soon to take up a new professorship related to planetary health at Cornell University, showing how this is gaining some quick traction around the world. And Steve has been a longtime leader on, he's a veterinarian by training and a longtime leader on animal, human health, and environmental connections and all of that, and is also a leader in a newly formed Planetary Health Alliance that's connecting research institutions around the world. To his right is Sam Myers, who's a research scientist at Harvard. And Sam has been a real pioneer in this thinking and this science over many years now. He is the director of the new Planetary Health Alliance. Both Steve and Sam served on that Rockefeller-Lancet Planetary Health Commission that I mentioned earlier. Moving on down, we have Renzo Ginto, who is a medical doctor from the Philippines. Renzo is also an Aspen New Voices Fellow, right? And he has been working a lot on climate change in health in Southeast Asia. So we're eager to hear from him. To his right, Thumbi Mwangi, also an Aspen Fellow, is a veterinary epidemiologist. And he's been looking a lot at the animal and human connections on health. He teaches currently at Washington State and as well as in Kenya. And last and never least is Donna Shalala, who's the president of the Clinton Foundation. And as you know, she's been the president of 2 major universities in her career and was Secretary of Health and Human Services here in the United States. So I thought we could get started with Steve and Sam to give a little scene setter of, what is this thing, planetary health, that we're throwing about here over this next hour. And what is it? How does it yield different solutions, bring different perspective to some of the challenges we're facing? So Steve, you want to get us started?
So thank you, Michael. I started really starting to think about this quite seriously around 2007, 2008. I was going to a lot of meetings around the world and in Washington, where I've been based, on ecosystem services. The importance of maintaining forests to sequester carbon or to provide fresh water. And I remember going to one meeting where a very frustrated minister of public health from a large country in Latin America stood up and he said, "My counterpart, the Minister of Forests, has sold X millions of dollars of logging rights over the past decade. But my ministry, the Ministry of Public Health, has spent orders of magnitude more on the malaria that followed that logging." And so there was just this stark left-hand, right-hand issue in the same government where the infectious disease consequence of the way that logging was done and the immigration of people was a total externality. Nobody was accounting for it. And yet someone was bearing the cost. And so I started to ask some of the luminaries in ecosystem services, why aren't you guys talking about health as a derivative ecosystem service? And the short answer was
when you talk about ecosystem services, you're talking about what?
The ecosystem services suite includes things like, as I mentioned, the importance of sequestering carbon in trees, the provision of clean air and water by forests, the provision of foods by coral reefs and fishery resources. It's the things that nature gives us that sustains our livelihoods and our health. But no one was really looking at the health aspect of this. So I thought we should be assembling a group of environmental conservationists, public health specialists, MDs, And gratefully, the Rockefeller Foundation agreed to support some brainstorming on these issues. And we started to look around the world, and I think we'll get into some of these examples, but if you look at things like the palm oil and paper and pulp industries in Indonesia, where land is cleared by burning, that haze that gets generated across what we've called the health shed caused hundreds of millions, if not billions of dollars of costs in terms of cardiopulmonary disease downwind in Indonesia itself, as well as in places like Singapore and Malaysia. And just to give you another example, if you think about the global viral scourges, HIV/AIDS came from a transmission from a chimpanzee to a person. We all are familiar with Ebola, and yet global companies that log in places like the Congo Basin are still not necessarily held accountable for making sure that their staffs are well provisioned in terms of food. So they're forced to eat wild animals, increasing that risk of another jump of an emerging infectious disease. As we heard yesterday, 75% of all these new diseases we're hearing about come from wildlife. So again, the logging companies, the mineral extraction companies, if they are creating this exacerbated risk but not bearing the costs, we are fooling ourselves in terms of what metrics really need to be. So we as a group, we came together and we thought we need to start to quantify these relationships. And I want to be very clear, we're intellectually honest about this. We are not pretending that intact nature always equals healthy. We drain swamps to get rid of malaria. We cut down trees and plant crops to feed people. We acknowledge that. But the question that was on our minds is, where is it a net-net win-win? Where is it that intact nature, coral reefs, savannas, forests, et cetera, pays a positive public health dividend? And most importantly, can we start to quantify that, not have it be an externality in dollars or in terms that the public health community can understand in disability-adjusted life years? And so I'm being very brief. These are complex issues, these relationships between what happens when people damage ecosystems and the public health consequences. These are complex relationships. They're not linear. They require good research to produce robust connections that are compelling. But if we succeed in this new field, we really hope that we can make more holistic and better informed plans in terms of land use planning, public health policy, environmental conservation policy. It's critical that we do this because the equity issues are significant. We are essentially mining the natural capital and borrowing the future from our children. And if we ignore the public health costs of these behaviors, it's at our peril.
So Sam, what do you have to add to what Steve, amazing presentation. But more, how does this kind of thinking yield different solutions than we're pursuing now?
Well, I think I'm going to echo a little bit of what Steve said. I mean, so I think that the core proposition of Planetary Health is that we all receive enormous public health benefits from a relatively stable set of biophysical conditions, whether we're talking about the climate system or land cover or biodiversity or coastal barrier systems or fisheries or biogeochemical cycles, that those natural systems give us, as Steve was talking about ecosystem services, a lot of health benefits. And that we're now facing a sort of quiet and barely visible, but nonetheless urgent public health threat as we transform those natural systems at a rate that is much faster, in a way that is much more pervasive than we have ever seen as a species. And the primary driver of that vast transformation of Earth's natural systems is human activity. I was thinking about this, I was trying to explain to my daughters a little bit about what I was talking about in Planetary Health, and I was saying, it's like for almost all of humanity, we were a monkey in a rocket ship, and we were passengers in the rocket ship with all the other species on the planet. And then somewhere around 4 or 5 decades ago, the monkey scampered up to the cockpit and pushed the big red button, and the rocket ship took off, and suddenly we own the rocket ship. And we're pushing buttons and turning dials and pulling levers, and we really don't have any real understanding of the consequences of transforming just about every natural system on the planet. And it really matters, because these are the natural systems that underpin our global food production system, our exposure to most infectious diseases, our exposure to natural disasters, even the habitability of some of the places that we live. And so I would say Planetary health is this emerging interdisciplinary field that is committed to very rapidly growing our knowledge about how transforming natural systems will impact human health. And Steve talked about some of the areas of research. We work on how rising CO2 affects nutrition, how loss of pollinators affects the mix of foods that we eat and nutritional and health outcomes, how the fires in Southeast Asia affect health. But then injecting that rapidly accumulating knowledge into the realm of policy and practice so that we can manage Earth's natural systems in ways that optimize human health outcomes to try to avert some of the kinds of public health threats that we're worried about. So to go back to the monkey, we need to teach the monkey how to drive the rocket ship as fast as we can before it crashes.
Dramatic imagery there. I'll let that set.
All right, with that as introduction, everything I'm going to talk about for the rest of the session really relates to that relationship between our own health, the health of our wildlife, the health of our domestic animals, and how, of course, all of that is underpinned by environmental stewardship. And again, going back to the personal, I first got to sort of explore the interface between people and nature before I came to vet school. It was about 1984, 85. I was 21 years old, and I got a fellowship to spend a year backpacking around East and Central Africa. I knew I wanted to be a wildlife veterinarian, and at the age of 21, I thought wildlife conservation was going to be about animals. But it didn't take long on that trip to recognize that conservation is all about people. It's about understanding human needs and aspirations. It's about food security and food systems. It's about poverty alleviation. This was epiphanal for a 21-year-old. When I came to Cornell, I got to do a lot of exciting things both here and off campus. I got to work, for example, on the Florida Panther Project in the Everglades. And just as an aside, I was working with Dr. Melody Rolke at the time, and this is where I learned that every wild animal that I got to handle was a precious opportunity. These animals were ambassadors of wild nature. They didn't sign up for a medical appointment to come see me. They were not volunteering to be examined or radio collared, but we took every possible sample we could: blood, feces, skin, ectoparasites, endoparasites, because it was our responsibility, our moral responsibility, to learn as much as we could about the health of these animals and their environment whenever we got the opportunity to handle them. And in the 80s, as today, the #1 and #2 causes of death of Florida panthers are being hit by cars and being shot. It's that interface between people and animals. Although, just as an aside, when I was a student in those pictures, there were roughly 40 Florida panthers. Now we're hovering at about 200, so that's good. I later became the first wildlife veterinarian for the Botswana Department of Wildlife and National Parks. Again, a life-changing opportunity. Here we are collaring wildebeest in the central Kalahari to try and understand their land use needs over space and time so that we could ensure that the migrations that they depend on could survive. Similarly, we were studying African elephants, and I was responsible for immobilizing elephants safely, again, learning everything I could about the health of the species while helping biologists put on radio collars so we could understand their migratory needs. I'm still working on this project today, using the policy arena to try and restore these migrations based on data we started generating in the 1990s. And human-wildlife conflict, again, that interface, whether it's Florida panthers or leopards in Botswana, that intensity of conflict between people and wildlife, recognizing that people who live closest to wildlife are the decision makers. They are the stewards of what's left of wild nature. So here we are trying to move a leopard that was killing cattle out of harm's way and to alleviate the farmers' concerns. That interface is only intensified since I was a vet student, obviously. So I got to do a lot of great fun science, hanging out of helicopters, darting rhinos and elephants, but I started to feel like the science I was generating wasn't always getting into the policy arena, right? I started to think about the fact that the landscapes I cared about, someone was going to decide whether they would be wilderness or wheat or under carnivores or cattle in the long term. And as a young scientist, I thought, well, if you build it, they will come. But this experience really put that idea out of my head. We have to be much more proactive in moving science into policy and action. And so I tell our students up at the vet school, eventually I hung up my dart gun. And I hung up my dart gun because the state of the world really was keeping me up at night. I want to just get us all on the same page. This is just a very basic summary of what I call humanity's ecological footprint. So we currently appropriate about half of the planet's ecosystem production for our own purposes. We have converted over half of the ice-free, desert-free surface of the Earth to crops and pasture. We use about half of the planet's accessible fresh water. We have caused the net loss about half of the temperate and tropical forests on the planet. The majority of the world's fisheries are fished at or beyond sustainable limits, and I mean sustainable from a conservation point of view, not from a maximum sustainable yield point of view. Those are different things. And we've dammed the majority of the world's rivers, and that has huge implications for migratory fish species, which millions of people around the world depend upon for micronutrients and basic nutrition. The bottom line is, if we weren't here, species extinctions would be about 1,000 times lower than they are. So we have sort of met the enemy, and he is us. We have to acknowledge that. And I'm sure many of you have seen the global headlines, right? And I promise you the talk gets brighter. I don't want you to all be depressed. I have a passion for this because I think we can make a difference. But humanity threatens 1 million species with extinction. We've all seen that. This report, the Living Planet report from WWF, it comes out every couple of years. It just came out within the past few weeks. And the latest statistic is between 1970 and today, the average size of wildlife populations has fallen by about 73%. So basically, since I was a kid, the average size of wildlife populations has dropped dramatically. So this slide summarizes why. This is the very basic issue that we're facing. And this is a graph of global populations. Most of the global models of projecting populations are in agreement. And we're at about 8 billion now. And in the decades to come, we're projected to get to about 10 billion. So we've got a numbers problem, but that goes hand in hand with a consumption problem, right? And everybody in the world, understandably, wants to live a lifestyle like we're accustomed to. You can't fault anybody for that. But if you think about that, if everyone in the world lived at the same standard that we did now, we would probably need about 3 Earths, and we only have 1. So we've got this combination of growing population and consumption patterns. And if you look, the graph is projected to level off, and all the models predict this, and that's good. So what I think about in terms of my job, and I am a conservationist first and foremost, even though I work through a health lens, I think about my job as getting through that bottleneck, having enough biodiversity around so as populations level off and we come through the other side, we'll be able to see what's left, be able to regrow and restore. So I'm cautiously optimistic. I tell our students that the glass is about 1/10 full, and I'll take that. So I want to take you back a few years. I started off with introducing the concept of planetary health, but I want to take you back to 2004 to the launch of the One Health concept. Just quick show of hands, how many of you have heard of One Health? Okay, that's great. Because at this meeting that we held in Manhattan in 2004, nobody would have raised their hand because it hadn't really been promulgated yet. In 2004, my colleagues and I at the Wildlife Conservation Society were feeling just a really passionate need to alert the world about the relationships we've been talking about. And I want you to remember, I'm going to read you the preamble to what became the Manhattan Principles on One World, One Health. This was the foundation of what is today's One Health movement 20 years ago. And I want you to see if you can tell if it's any different from what we're seeing today. Recent outbreaks of West Nile virus, Ebola hemorrhagic fever, SARS, monkeypox, mad cow disease, and avian influenza remind us that human and animal health are intimately connected. A broader understanding of health and disease demands a unity of approach achievable only through a consilience of human, domestic animal, and wildlife health. One Health. Phenomena such as species loss, habitat degradation, pollution, invasive alien species, and global climate change are fundamentally altering life on our planet from terrestrial wilderness and ocean depths to the most densely populated cities. The rise of emerging and resurging infectious diseases threatens not only humans and their food supplies and their economies, but also the fauna and flora comprising the critically needed biodiversity that supports the living infrastructure of our world. The earnestness and effectiveness of humankind's environmental stewardship and our future health have never been more clearly linked. To win the disease battles of the 21st century while ensuring the biological integrity of the Earth for future generations requires interdisciplinary and cross-sectoral approaches to disease prevention, surveillance, monitoring, control, and mitigation, as well as to environmental conservation more broadly. That was 20 years ago, and now we've lived through COVID, and just this past week, our own USDA has finally decided we should be monitoring milk for H5N1 avian influenza, given that dairies across the country are infected with this virus. Unfortunately, we haven't learned all the lessons that we had hoped when we launched the planetary health concept. So we are living in what others have described as the Great Collision. As Dr. Myers said in the video, human activity is rapidly altering all of our landscapes, all of our biogeochemical cycles, including the climate system, in ways that are simply unprecedented. So in response to this, back in the early 2000s, mid-2000s, as I said in the video, I realized we had to create a more integrated way of thinking about these problems. And I started a consortium where I brought together people from these different sectors, from public health, from conservation, from economics, into a consortium called HEAL, Health and Ecosystems Analysis of Linkages. And that's the consortium that the Rockefeller Foundation, the MacArthur Foundation, the Gordon Betty Moore Foundation supported, so we could really think about the relationship between health and natural systems. And out of that, we were able to start to look at global trends. And if you're in the back of the room, it doesn't matter if you can read the individual graphs, but you should all be able to see they're all parabolic, right? These graphs are, for example, rises in atmospheric CO2, consumption of fresh water, fertilizer consumption, number of vehicles on the road, losses of biodiversity, depletion of ozone. All these metrics are moving in the same direction. That's instructive. And so what this consortium did is we did a global analysis of what we really knew. And this was about the relationships between natural systems and public health. And again, I think it's important to keep in mind how recently this was done. This paper came out in the Proceedings of the National Academies of Sciences in 2013, basically a decade ago. And we looked at all the literature we could find on the human health impacts of ecosystem alteration. And 10 years ago, we could find almost no examples of science that demonstrated a measurable change in a natural system or a habitat and a measurable, quantifiable public health change in a public health outcome. There was lots of gray literature, particularly put out by the NGO community with good intent about the relationships between deforestation and vector-borne disease, et cetera, but the science wasn't there. So that told us we were onto something. We needed better science in order to credibly try and influence policy. And so out of this, we created the whole concept of planetary health. And one of the things we realized, just to make this easier to think about, is all public health issues, and we can argue about this, but I think they more or less fit into 4 buckets. We have communicable or infectious diseases, non-communicable diseases, nutrition, hugely important globally, as well as psychological or mental health, social health. Those 4 buckets capture all the basic dimensions of health, and all of them are impacted by the state of our natural systems. So at the centerpiece of our study in the Proceedings of the National Academies was this graph. And I do want to spend a few minutes walking you through this because I think it gives us some direction. So the vertical axis here is population health status. If you go up the vertical axis, that means you're getting healthier. And the horizontal axis is ongoing degradation of our ecological systems, the destruction of forests and coral reefs and savannas. And there are 3 arrows. And what you should notice is the top 2 arrows represent the wealthy and middle classes of the world. Basically, obviously, everybody in this room. And as we're degrading the planet's systems, somewhat paradoxically, the health of the wealthy and middle classes of the world measurably is improving. We know this. How is that possible? It's because we, in the developed world, have access to markets and infrastructure and hospitals and CVSs and Rite Aids. So we're essentially able to replace some of nature's services with these markets and infrastructure. But if you look around the world at the poorest of the poor, the people who live closest to wild nature and depend on wild nature for food, fiber, shelter, their health is declining because they can't replace those services with markets and infrastructure. And so what we have right now is a fundamental social inequity, right? It's obvious and it's getting worse. But I want to take you even further, because if you were to continue this graph in its logical direction, and if we continue to degrade our ecological systems, if we meet back here in, say, 50 years, I'm willing to bet you that if we don't change what we're doing, that those top two arrows are going to tip down. That we are currently building our public health gains on a foundation of sand because we're neglecting the importance of these natural systems. So what we really have, longer term, not only do we have a social inequity issue now, we have an intergenerational equity issue on into the future, where we're, as I said at the Aspen Ideas Festival, we are essentially borrowing the future from our children and grandchildren. So this gives us a real mandate to rethink these issues and do something about it. And that's why we did this big study with the Lancet. And you heard a little bit about it. It's called Safeguarding Human Health in the Anthropocene. And it was all about starting to document and map out ways to prove these relationships. And again, very importantly, move them into policy and practice. So out of that Lancet Commission study, we define planetary health very broadly. So the first thing I'm going to share with you is the official definition from the Lancet study of what planetary health is, and it is the achievement of the highest attainable standard of health, well-being, and equity worldwide through judicious attention to the human systems, political, economic, and social, that shape the future of humanity and the Earth's natural systems that define the safe environmental limits within which humanity can flourish. Put simply, planetary health is the health of human civilization and the state of the natural systems on which it depends. Now, that's a very high-level definition, and I found it wasn't as useful as I was hoping operationally. So I published a different definition later on in the Lancet Planetary Health, which is much more mechanistic. To me, if One Health that I introduce you to, if One Health is an approach, One Health is just recognizing that these things are all related. But planetary health is a goal-directed transdisciplinary field. Planetary health is a field focused on improving our understanding of and our ability to measure the public health impacts of anthropogenic environmental change. Why? So we can better inform decision-making in the land use planning, ocean use planning, environmental conservation, and public health policy realms. We've got to be able to measure things in order to manage them. And so this is the operational definition I use of planetary health. And you can see if that planetary health, I started to get some flack from my conservation colleagues. Remember, I'm a wildlife veterinarian. And they were like, why are you doing all this public health stuff? What happened to the wildlife? And my argument is, when I was traveling around the world for the Wildlife Conservation Society, I was relegated to meeting with the Minister of Environment or the Department of Wildlife and National Parks, the weakest parts of most governments around the world. I wanted to be meeting with the Minister of Agriculture, the Ministry of Finance, or the Ministry of Public Health. And I realized in those days that the biggest lever arm I could pull, I think in the opening you talked about pulling lever arms, the biggest lever arm as a conservationist I thought I could pull was public health, because governments around the world, biodiversity conservation is often a luxury, but even the most unstable governments recognize that they have to try and serve some semblance of public health needs in order to maintain power. Public health matters. But my conservation colleagues were saying, you're a sellout. You're just thinking about people. You're very anthropocentric. I had to start writing editorials in the conservation journals to bring my conservation colleagues around. This is one from Conservation Biology, that human health is an opportunity for us to cross sectors and all be pulling in the same direction. So that's been an interesting part of the journey, to recognize that being anthropocentric is also a selfish way of being a good conservationist if this works. So as you heard, we started the Planetary Health Alliance in 2015, 2016, and it was, just as I was coming to Cornell, it was housed at Harvard. It just moved to Johns Hopkins. I think there are about 500 NGOs, government agencies, other institutions that are now members. And the whole point of it is, again, doing better science, but moving that science into policy. And a very simple way of describing my goal for this was that we were trying to figure out whether, when, and how public health is a benefit provided by relatively unmodified ecosystems. I want to give you an example of what I mean by that. I have a fantasy. I'm going to share a fantasy with all my best friends here at the Statler Ballroom. My fantasy is I'm stuck in an elevator with Bill Gates, and I love what the Gates Foundation does, don't get me wrong, but when I think about things like childhood diarrhea, kids under 5, childhood diarrhea, a Gates approach would be all focused at the tap, and I understand why, on vaccinology, on water filtration, and in the elevator with Bill Gates, I want to ask him, what about the forest that's providing the water that those kids are drinking? We have a continuum. We call it the forest to faucet continuum. What if conserving that forest yielded more cost effectively, per gallon of clean water as an intervention than the filtration that you're doing? And those of you who know the story of New York City, that's how the water system is managed in New York City. It's the Catskills that's the key. So it's about getting that Gatesian approach, that high-tech approach, to think more robustly about a systems approach. So all this is happening. I've sort of helped create this One Health concept, helped launch Planetary Health, and I came to Cornell, and actually the last day before the lockdown, I was in this room. We were doing a seminar with the provost, and we got locked down in COVID, and I thought, surely as someone who thinks about emerging infectious diseases and who wrote about things like Ebola and SARS and the Manhattan Principles on One Health, surely there's going to be a silver lining to this tragedy, right? We're going to learn that our broken relationship with wild nature is why we're in this mess, and we're going to reform our ways. And like many of you during COVID, I did a lot of writing about this being a never again moment, and that we could seize the momentum, the realization that this stark outcome had yielded, to think more critically about changes we needed to make. We had webinars. We did one during COVID. We worked with the Atkinson Center and World Wildlife Fund. And in lockdown, we had Tom Friedman from the New York Times as our host. We had Jane Goodall as our keynote to talk about, again, the stewardship of wild nature and why SARS-CoV-2 had broken out. And I was, like many of us, looking for, again, a silver lining, hoping we would learn from this. And I guess at this point in time, I'm not sure we have. As I mentioned, we're currently in a scary situation with avian influenza around the world, a virus that's infecting species like elephant seals and bears, never mind dairy cattle, obviously poultry and wild birds, like we've never seen it before. There's an article out this week that some scientists think we're one mutation away from having this virus be able to move more easily person to person. We've had 60 people infected in the United States so far. It's a scary time, and I feel like we need to do more to make sure that these lessons get taken up. So I've covered a lot of ground, but I just want to wrap up with a few thoughts. I've used the terms One Health and Planetary Health, and I tell my students, I don't really care what you call it, but what I want you to remember is how this integrative, cross-disciplinary approach is so critical. I tell our vet students, we're going to train you to be the best veterinarians that we can, but the tools that you have are only a subset of the tools we need in the toolbox to solve these globally complex challenges, right? We need all the disciplines that, the Cornell helps train the next generation for to solve these problems. So I haven't talked about conservation medicine. I haven't talked about eco-health. These are all related terms. But the bottom line is think integratively about health as it relates to environmental stewardship, and we'll all do better. So the motto, if you will, of our Cornell K. Lisa Yang Center for Wildlife Health, which is a university center, is we need nature, and now nature needs us. Hopefully, in the past half hour, you better understand why I think we need nature. We desperately need nature. But when I write, now nature needs us, I've gotten pushback on that too. Nature doesn't need us. Nature will be fine. We just need... No. Nature needs us to be more mindful. Nature needs us to be more respectful and to be better stewards. Because if we don't think more proactively about our stewardship of whether it's the climate system or other biogeochemical systems or all the different natural habitats that we've talked about, it's at our peril, both now and in the future. So I do think we need nature, and I do think now nature needs us to move the excellent science that's starting to be generated on planetary health into policy and action, because I do think we can get through that population bottleneck and come out the other side with a semblance of healthy biodiversity and a more enlightened understanding of our dependence on it. So with that, I'm going to wrap up, and I thank you for inviting me again to this symposium.